and it was from diverticulitis and an abscess. So one day I was in the emergency room and the next day I was in surgery. And he gave me a colostomy. It was a temporary colostomy. And I had it for about 5 months, and then they did what they call a colostomy reversal. So they took it out and hooked me back up. When they did my first surgery, they took out my rectum, the last section of my colon, the sigmoid colon, which is about that long. So when they hooked it back up, they just hooked up the two ends that were left. And so now I'm just missing a little part of my colon, but I don't need the ostomy anymore. But that 5 months was pretty interesting. I was teaching at another school here in the area, and I learned a lot that I didn't know as a nurse. I learned a lot more about having an ostomy as a patient than I ever would have learned as a nurse. And so that's kind of why I like to talk to you all about it, because it's two viewpoints. So the first thing that I want to share with you is a couple words, definitions. A stoma is simply an opening. So I know you've talked about tracheostomies before. That's a stoma, technically. So we're not just talking about colostomies as an opening. And then an ostomate was what I was, a person who had a stoma. This patient right here is an ostomate. So that's a word that you might hear sometimes. An ileostomy then is an opening from the ileum to the outside of the body. So what part of the bowel is the ileum? Anybody remember?
We talked about that first thing.
Somebody said it, just speak loud.
Small intestines, right. So when you think about the differences between an ileostomy and a colostomy, you have to think about the function of it and what happens in those places. So in the small intestine, what is the function of the small intestine? What does it do to the contents that are going through it? Absorption of nutrients, yes. So it's still pretty liquid. So that makes it kind of logical then that the drainage from an ileostomy would be very liquid. If we go to the colostomy, that's an opening from the large colon to the outside of the body. And so at that point, the nutrients have been absorbed, but there's some water that still might be left in there that wouldn't be the same as what would come out of a person's rectum. So depending on what point in the large intestine the opening was created, there might be semi-soft to normal firm stool. So it just depends on the patient in that case. But if you think about the anatomy, I think you can see that if you have a colostomy, if that's the large intestines, then where's the stoma going to be? On the left side of the body, left side of the abdomen. If you're talking about an ileostomy, then that's the small intestines, and that opening is going to be on the right side of the body. So a lot of times, if you get a report on a patient and they tell you, almost always they're going to say it's a colostomy, because that's the first thing that comes to nurse's head. Well, it might not really be a colostomy. A lot of times it's an ileostomy. But you can tell by looking at the patient, usually, if it's on the left side of the abdomen, it's probably a colostomy, large colon, right side of the body, probably ileostomy. There are patients who have both, and you can go online and look it up, see pictures of people that have both sometimes. There will be unusual cases where it wouldn't be colostomy on the left, ileostomy on the right, but that's going to be pretty rare. And the supplies that we use vary from person to person. It just depends on what they were taught in the very beginning. So normally when you have, a lot of hospitals will have a enterostomal therapist, which is a person, a nurse, who was a nurse first, and then they got certified in ostomy care. A lot of those enterostomal therapists are also certified in wound care. So they've gotten all this extra education, and so most of the hospitals, Memorial has one, Erlanger has one or two, they'll come around and see the patients before surgery and after and do teaching and follow-up, and that's their job, is to help with the patient care for wound care, but specifically for ostomy care. And then they teach the nurses a lot as well. Certainly anybody who has an ostomy could come in the hospital for something else besides that surgery. So if they come in because they need to get a knee replacement, then they're still going to have their ostomy and somebody will need to help them with that. Although a lot of times if they're with it enough, you could just let them do it themselves and just make the supply, get the supplies for them. So the supplies that we use are I call it a bag. That's the bad word to use, but since I was a patient, I think I'm allowed to call it a bag. But as a nurse, you should call this a pouch. That's what the correct terminology is, a pouch. And I think you can see that this one's kind of tan, like these right here, so you can't really even see the stool that's in there. Why would that be better than a clear one like this? Well, as a patient, do you really want to be looking at your stool every time you go to the bathroom and pull your pants down? No, you don't. So that's why they make it kind of opaque, I guess you could say that. So you can't really see what's inside. So then we have a ring and a wafer. Here's the wafer. The ring and the wafer are made pretty much of the same kind of material. And I don't even know what it's technically made of or what you would call it. I think you have some on the table there. It would be this part right here. That would be the wafer. And it has adhesive on the back so that the patient can attach it to their skin. This material here is what the wafer is made, or the ring is made of. And it's smaller, as you can see in this picture. It's smaller. And what you do with that is it's pliable, so you can put your fingers in there and stretch it and mold it to the size that you want so that it can go around the stoma. So that's the ring. And then here's the measuring guide, and I think there's a couple out on the table. This is the one that I have here, and most of these are they're not like cardboard, they should be plasticky, because if you get stool on them, then you can wipe it off and use it again. Frankly, I've never seen a stoma that large, but what you do with this is to measure. So you would lay it over top of the stoma to see which size. See, now this one's still too little because it doesn't lay on the patient's skin. That one's too little, it doesn't lay on the patient's skin, but this one lays down on the patient's skin. So that's the size for this one. So we'll use that again in just a second. And then here's another pouch, a different type of a pouch because of the bottom, of the closing. This one has Velcro on it, and this one has a clip. So here's a Velcro one, and you just undo the Velcro